Hello, today is October 26, 2021. I took care of my patient this morning at clinical. My patient is a 54-year-old Caucasian female. She came to the visit voluntarily for a routine medication review. My nurse practitioner has been taking care of this patient now for 2.5 years for management of bipolar 2 and PTSD. When asked how patient was doing, she said she was not doing good because she started chemo and she's just in a lot of pain and is not able to sleep or eat as she would like to. Okay, a little background on my patient. She grew up in a healthy environment, she said, and she has three sisters. She gets along with all of them, and they're doing good. Patient never had any children of her own. She has two cats. She has been working the same job now for 20 years. And she says she's close to her friends, family, and work. She had two cats and she calls them her babies. Okay, we'll now go to the mental status exam. Patient is well groomed, appearance appropriate, her affect is somewhat depressed. When asked about her mood, she said blob. She denied depression, she denied mania, and she denied anxiety of any kind. She denied hallucination or delusion. She said her temper has been good, memory intact, speech is clear, logical, and follow the content of the assessment without any difficulty. Patient is alert and oriented times 3. She denied any suicidal thought or any thought of killing herself. She did not poor sleep. She said it has been very difficult for her to sleep due to the pain. She said she's feeling a lot of pain from her chemo. Eating, she said she has poor appetite due to the chemo, and she has lost like 30 pounds in the last 2 months, and she's very upset about that. For exercise, she said she had not been doing much because it's very painful. She feels pain all the time, and she's very tired when she comes from chemotherapy. Okay, now we'll do the DSM-5 ISIS. ISIS 1 is bipolar 2 and PTSD. ISIS 2, I would defer that. ISIS 3, she had cancer. ISIS 4, the psychosocial environmental factor, patient is doing okay. She never been married or have any children, but she close to her parents and her siblings. She, like I said before, she's been working the same job for 20 years, and she said everybody's there. They are like family to her. She gets along with them. And she had two beautiful cats that she loves. She says kind of getting tiresome to go to work, but she still goes to work, and she said money-wise, she's doing okay. She said she's not worried about insurance or anything like that. ISIS 5, the global assessment functioning, I gave her 86. Patient is doing really good. My differential diagnosis for the patient will be general anxiety because of her chemo and her illness and work and everything she has to do. She says she has lots of family, but she's very independent and she doesn't like to ask for help. Okay, medication. Patient has been on Lamento 200 milligram daily, Gildan 80 milligram daily, Atarax or hydralazine 25 milligram, PRN-TID. What will be the plan for this patient? She will continue the Lamento 200 milligram, the Gildan 80 milligram, the Atarax for PRN. And then we are going to add Romarine 15 milligram because she lost weight. She's not eating. And this will help her with the eating and the weight and the depression. So we're going to do that for her. All right, my references as the show Prescriber Guide 2021, and then the American Association 2013. Thank you. Have a great week.